because we know that there is a lot to discuss. And what does equitable access even look like?
You're about to watch an episode from the Periodic Effects podcast. You can also listen on any podcast app or download our custom app in the App Store on your phone. Just search Periodic Effects or go to periodiceffects.com. Now let's get into the episode. Joining us today is Sam Chapman. He's the Executive Director for the Healing Advocacy Fund. And I'm excited to have you on today, Sam. You're instrumental in passing medical cannabis in Oregon, and most recently, the campaign manager for Measure 109, passing a program for medical psilocybin, magic mushrooms, as some people, kind of have heard them referred to as. And excited to hear about kind of your story and process and where we're at right now in the industry with cannabis still not legal at the federal level, and then now legalizing psilocybin for medical use is going to be very interesting. So thank you for taking some time today on, and excited to chat and share with our listeners.
Yeah, thanks for having me, Wayne. Really appreciate the opportunity. And so much to talk about. Where would you like to start here?
I'm always fascinated starting off, and I've done some research and learning about you, but kind of your story in getting to this position, because it seems very unique. In Oregon, the first to pass medical psilocybin is very fascinating. But going back as far as the medical marijuana program in Oregon, what did you do initially, your work background, and how did you get into this advocacy role, writing and helping, push legislation and bills up until this point where we're at now?
Yeah, good question. So I've been involved with progressive drug policy reform here in Oregon and really across the country for about the last 12 years. In college, I got involved with a group called Students for Sensible Drug Policy. Yeah. And so I did a lot of different advocacy around medical cannabis advocacy, know your rights for college students, what happens when you're mixing certain drugs together, right? Which a lot of people don't agree with. But, if you've ever been to college in the last, ever really, right. People are mixing all kinds of things together. And so I felt incredibly passionate about education, about policy, and really about reversing the draconian laws that we have on the books right now as it relates to drug use. I personally believe that we all have the right to put what we want in our bodies. And as long as we're not harming other people and we're educated in what we're doing, we have the right to do that, regardless of what the laws are. And people are doing those things regardless of what the laws are, right? So I think it's really important that people have that foundational understanding of what it is that they're doing, and if they're going to do it, how to do it safely. And so very early on in college, I was identified by some medical cannabis activists in Eugene. I went down to the University of Oregon and got my degrees in philosophy and political science. And very early on in my advocacy, they reached out and said, look, you look like an energetic, passionate young person that has an interest in potentially helping us. And it turned out that I very much did. I got to meet a lot of medical marijuana patients in Eugene, many of which were poster children, literally would not be alive without the medical cannabis they had, and really started to get a deep appreciation for medical cannabis and the program and the people that it served. And so it was through my entrance into medical cannabis advocacy that I really started to get my feet under me. Right after graduating college, I co-authored House Bill 3460, which is the law that legalized medical cannabis dispensaries here in Oregon. Shortly after that, I formed my first consulting firm called New Economy Consulting, where I did everything from helping, maybe 10 to 15 different cities and counties draft time, place, and manner regulations to helping folks identify and take down property and license dispensaries and grow operations, all that kind of thing. So very much had a dual policy and entrepreneurial path throughout the cannabis industry. I was very grateful to be able to do work on some local equity initiatives within the cannabis industry as well. I served on the Minority Cannabis Business Association Equity Policy Committee for a couple of years and helping draft equitable policies in the cannabis industry. And that really helped me kind of illuminate the larger opportunities that we have, especially now that we're moving into psilocybin therapy program, and the importance of really centering and including, BIPOC communities, people of color, right? People that have been traditionally left out of these conversations, people that we left out of the cannabis conversations, and how to create an equitable, affordable, accessible program. And so, my history in the cannabis industry, I think probably put me on a short list for candidates for the position of campaign manager. I actually interviewed for the political director position with the campaign initially, and did not get that job because I was slightly overqualified. And so that's when they decided to give me the campaign manager position. And, really feel humbled and privileged and lucky to continue to play a small but important role in moving the needle forward, especially when it comes to creating access to medicines that have been used for thousands of years, but not necessarily in a licensed and regulated context, ensuring that we can really put patient and client safety and facilitator training first, while simultaneously ensuring that the program that we create is actually affordable, accessible, and equitable for as many people that stand to benefit as possible. I'll be the first to say that is easier said than done, but that is the challenge that we now have before us now that we have passed Measure 109 and we're moving into the 2-year implementation phase, which I'm sure we'll probably get into a little bit more. But that is the nutshelled history of how I came to where I am over the last 10 years, really.
Yeah. Looking at cannabis now and where we're at and thinking about that equity and social fairness even of what the future of the market's going to look like, does it feel like it's now slipping past the grip of that? I mean, with the multi-state operators, money coming in certain states, absolutely. If you're on the East Coast, I mean, when you got to have a few $1 million to even start, that rules out almost, a lot of people. Oregon is more pro competition, but still very difficult. Do you see that kind of being something that, I don't want to say losing battle, but what the future of cannabis is going to look like with the route we're on? How do you see that now?
I'm not excited about the current trajectory of the cannabis industry. Let me be frank with you. The fact that we didn't include equitable regulations in our cannabis regulation, straight up, right? And I take, to the degree that I was involved with that, I take full responsibility to the degree that I could have, done a better job at that, right? And I think that's one of the reasons why I've lit such a fire under my own ass, to learn from those mistakes and those missed opportunities as we move forward into the psilocybin therapy program. As you mentioned, Oregon has, we're one of the few states that doesn't have a licensing cap, right? But we're on the other end of the spectrum where it's pure competition, right? And whether you like it or not, we live in a capitalist society and a capitalist economy, and those forces are going to play, right? And so we could have definitely done a better job. That doesn't mean that we don't have opportunities in hindsight. And I think that for those of those listeners out there who are going to be following the upcoming Oregon legislative session, there's some really exciting equity language that's going to be introduced to introduce new equity licensing, giving preference to certain licensees based on, their experience, their background, their history, things of that nature. And, should we have done that years ago? Yes. Is it too late? Not yet. But I think, a lot of things that's going on in society right now, racial, social justice wise, BLM movement, the governor has made it very clear here in Oregon that she is only interested in working with legislation and signing legislation that does have a focus on racial and social equity. And so that's incredibly encouraging. That's no guarantee that on the cannabis side, we're going to have any major transformations, but, we've got more people of color in the legislature than we ever have before. And we've got more young people in the legislature than we've ever had before. Again, that doesn't guarantee us anything, but the trajectory and the opportunity is still there. It's ours to seize and it's ours to lose. And so I do think that anyone who's interested in participating in that conversation as far as equity in the cannabis program goes, I absolutely encourage you to pay close attention to what's going to be happening in the legislative session in 2021. There's going to be a lot of really cool, needed legislation that's introduced, and it's going to need a lot of support. It's not going to, none of that is slam dunk, right? And so I think that, definitely, New Leaf Project, Oregon Cannabis Association, Oregon Retailers Cannabis Association. These are all organizations that are working together on that legislation, and they're putting their money where their mouth is. Again, could that have happened earlier? For sure. Is it still good that it's happening now? Yes, absolutely. And so we do have an opportunity on the cannabis side of things to make a difference and to hopefully try and make up for some of the lost opportunity that we didn't seize when we should have originally.
Yeah. Before we jump what over to psilocybin, what is the kind of magic wand answer? Like if you had the magic wand, you could set up the ideal perfect system for an equitable cannabis market. And I struggle with this, and I think about it a lot because there's one side where, like I've seen on the East Coast, where they'll have a kind of like, I don't know what they call it, but they'll bring someone in for like equity or minority, but it's a really expensive market, and they might be able to raise money and do that, but for anyone, like that's a difficult path without a lot of money for later down the road. At least on the West Coast, I always thought of it as lowest barrier to entry possible. Now, that's not specifically for one group and not another, but at least more people could try and have a chance. But what else is there, again, back to that magic wand question, that if you could set in place, you think would really kind of help and be the best path forward?
It's the golden question.
It's really hard.
It is, again, easier said than done in striking this very delicate balance between ensuring client and patient safety and facilitator training and the experience and the knowledge and the things that you need to provide those services in a safe and effective manner, while also ensuring that those things are not burdensome from not only people participating and accessing services, but from achieving licensure as well. Both of those things are incredibly important, right? And I think that some of the nuances that we'll be dealing with on the psilocybin side is that, one, we are the first state to move forward in this, creating the first of its kind psilocybin therapy program at the state level, right? Not only that, but to where anyone over the age of 21 that is not contraindicated will be able to have access to this, right? So that's one of the exciting things about this measure, is that we are getting rid of the idea that you have to have a qualifying condition, right? This is a historical piece of medical cannabis that we've seen be a barrier to entry, right? There's plenty of people that are suffering from depression that have not been diagnosed with the clinical, with clinical depression, right? Those people should still have access so long as they can show they can safely benefit. And so I think that we've really got our work cut out for us. And it's one of the reasons why we decided 2 years was what we wanted to give ourselves to develop the rules and regulations for this program, because we know that there is a lot to discuss. And what does equitable access even look like, right? What does it look like within a psilocybin therapy program that exists within the larger context of healthcare in general, that is already arguably incredibly inequitable and inaccessible for the most vulnerable populations that stand to benefit from having basic healthcare, right? So we're not going into this with our eyes closed or any kind of naive mentality at all. We very much understand that we've got an uphill battle to climb, and really starting to ask ourselves these questions in a real way and not shying away from the fact that this isn't going to be easy work, right? But we take our responsibility in going first very seriously. And we think that the fact that we've given ourselves 2 years to really dive into these conversations, involve community members, involve the people that we're actually talking about, giving them, leadership positions and helping drive the conversation. We absolutely need all those community stakeholders to be involved. We need insurance providers to be involved, right? One of the most common questions I get is my insurance going to cover this? The truth is, I don't know. And anyone who says that they do know probably doesn't. That's the honest truth, right? But it's going to take, the campaign. It's going to take the Healing Advocacy Fund. It's going to take the Oregon Health Authority. It's going to take the governor's office. It's going to take insurance companies. It's going to take people that have been doing underground work. It's going to take doctors. It's going to take licensed therapists. It's going to take, the entire community and all of the stakeholders to really come together to put forth our best foot forward. And again, striking that balance between safety and efficacy and affordability, accessibility, and equitable access overall. And so I'm incredibly excited about that challenge. It is a challenge. It is fraught with existing problems, but every problem that is presented within this 2-year rulemaking period, there is an opportunity within that, right? We're the first people that really get to dive in at a granular level. And what happens here in Oregon over the next 2 years during this implementation and rulemaking phase will, without a doubt, have implications across the country and around the world for the next 10 years to come. And that's our opportunity to seize, and it's ours to lose, right? And I think we saw this in cannabis too. Even if you're the first state to move forward and you've got a terrible program, you are still the model for every other state moving forward, right? Colorado went first, not the best cannabis program in the world, right? But it's the one state that everyone continues to look at. I think we can expect the same thing to happen for psilocybin therapy. And again, that's why we take this next phase in the process so seriously. And we're excited to create the best program we can.
Yeah. Yeah. And there's probably a huge benefit to having seen the cannabis program happen on medical and then go through recreational, and just there's really been no market like that in our recent times, in the last 100 years. Well, I guess after alcohol prohibition, maybe, where a new market that big with that much potential had to be developed and executed while combating a black market and, balancing all of this. And psilocybin is going to be kind of a similar, at least parts of it will be similar to cannabis. I want to lead up to Measure 109 passing, and I was kind of, if you want to lay out the progress of like when you started working on that, what the process or challenges were, opposition, and just kind of a first question to that. Were you surprised when it did pass as the first time being voted on? I wasn't as clear you were deeply involved in it, but when I saw it pass, I was like, I thought that would have taken 2 or 3 tries,
Yeah. in hindsight, I'm not surprised that it passed. I am impressed at the rate at which it passed. 56%, nothing to sneeze at, right? We got almost half of all Oregon counties voted in favor of Measure 109.
Wow.
I don't think any state in the country probably, well, maybe in the last year this isn't true, but most states in the country can't say that for cannabis, right? And I think there's an interesting item there, which is that while cannabis and psychedelics in general carry each of their own stigmas, and some of those stigmas absolutely overlap, they are very different in the type of stigma and how that stigma came about, right? Cannabis was very racially motivated, right? Psychedelics was more, anti-war protester, crazy hippies, type of Nixon, knee-jerk reaction, psychedelic renaissance backlash type of thing, right? And that's one of the reasons why, psilocybin, is viable in that sense. And that, sure, like some people have a negative stigma with psilocybin, but what we learned in the campaign is most people have no idea what psilocybin was, right? But when we were able to educate them on 4 basic points, we were able to sway a lot of people that ended up making up the 56% yes vote. So when we were able to educate people on what psilocybin was, what the studies are showing at major medical institutions around the country and around the world, Johns Hopkins, NYU, UCLA, Imperial College of London, et cetera, right? When we were able to explain what Measure 109 was, and sometimes more importantly, what Measure 109 was not, right? A lot of people, especially here in Oregon, because we do have legal cannabis, thought, oh, wow, this is just going the same model as cannabis. There's going to be mushroom stores on every corner. It's going to be totally, it's going to be crazy. That's not it, right? And so when we were able to convey this is not legalization, this is actually a very well thought through therapeutic model that will be regulated and licensed and supervised throughout. And then last but not least, who stands to benefit from having access to this program? That's really where we were able to reach into the hearts and minds of Oregon voters and help them understand that, look, we'll be the first ones to admit psilocybin therapy isn't for everyone. And we're not pretending that current available options for people who are suffering from depression, anxiety, addiction don't exist now. There are plenty of options that exist now that work for a good number of people. And especially in the middle of this pandemic, we are starting to see the rates of anxiety and depression and addiction skyrocket, right? We know we need more tools and more options for where currently available options have fallen short, right? And so one of the things that we were able to really point towards, despite psilocybin still being a federally, illegal Schedule I drug, is that, a little bit of hypocrisy in that the FDA has given psilocybin a breakthrough therapy status for major depressive disorder and treatment-resistant depression, which really just helped highlight the hypocrisy around scheduling of drugs in general. It's like, obviously these were political and not scientific, because you literally have federal government agencies saying the opposite of what the schedule dictates, which is that Schedule I has no medical value, right? So I think that is one nuance that we had with psilocybin that we weren't able to say with cannabis, right? There are no real studies going on at the federal level because it's Schedule I and the FDA has stayed silent on it for the most part, right? We've got a new trajectory with psilocybin. And I think that it's a trajectory that, because it's a different stigma that I think is easily overcome with education, more easily than cannabis was, and the amount of people who stand to benefit, right? We all know someone, if not ourselves, that has or is currently suffering from depression, anxiety, and addiction. And so, when you're able to help people kind of step outside themselves and step into their mother's shoes or their best friend's shoes or a coworker's shoes that's suffering, it really helps them, maybe it doesn't get rid of their own stigma, but they can understand why someone else that they love and care about might benefit. And so when we're really able to kind of package that narrative together in a fairly short amount of time, right? In 30-second TV commercials, for example, it was incredibly persuasive. And I think that regardless of what model, whether it's exactly like Measure 109 or some hybrid or something more liberal or more conservative, that is the model for educating the general public on the future of psychedelic medicine and alternative medicine in general and psychedelics. And I think we really showed and proved that with not only winning Measure 109, but in the style in which we won it, with 56% being the first time we ever tried it. So I was not surprised that we won. I was incredibly encouraged and stoked to see at the rate at which we won and how effective our messaging was.
With the FDA making that statement, breakthrough therapy around psilocybin, that definitely surprised me. And we're very cynical, rightfully so, when you look at cannabis, still Scheduled 1, almost like psilocybin just kind of like sped up and is more from the FDA's perspective, when cannabis has this history that we've been looking at and all these states legalizing. But when you see that, you always go, well, what's the motivation? Because if the government decide like they're not doing that for cannabis, so why did they do that around psilocybin? Is there motivations from like the pharma side, or, that seems interesting and surprising for them to do that? Do you have a feeling or know specifically, was it just based on the science and there wasn't the opposition force to fight it, so they did it? Do you have an idea about that?
It's a really good question. I could certainly speculate, but, take it with a grain of salt. I mean, I'm looking into my crystal ball just as much as anyone else is, or my historical crystal ball. I really just think it comes down to the political and historical context in which this was made illegal in the first place and why, right? For cannabis, it was to put people of color in jail, basically, right? To feed a new prison system, right? For psychedelics, it was, this is how we're going to hamp down on all of the anti-Vietnam protesters, right? That are all out there, tune in, drop out type of thing. We got to nix that, right? And so I think that they're just different. So, and I think with psilocybin, because the stigma was not as strong, I will say. I mean, look, there's still people doing time that shouldn't be doing time for, psychedelics, right? And that's absolutely true. It's not really comparable to the amount of people who are doing time for simple possession of cannabis, right? Sure. Like, sorry, like if you want to talk about ending real prohibition, we got to get out of this psychedelic decrim exceptionalism stuff. Like, I get it. There are people in jail for psychedelics and stuff, but if you're serious about racial and social justice and ending prohibition, like, we can't only talk about psychedelics. It's really ignoring the larger problem of like, we need to decriminalize small possession of all drugs if we're serious about ending prohibition. Different conversation for a different time. But yeah, I mean, I think it really just comes down to historical and political context that has followed us up to this point, right? And, I think being able to point towards major institutions that have been doing this research and the FDA was huge, right? Again, it allowed us to highlight the political hypocrisy more than we've ever been able to do with cannabis, even though the hypocrisy is at equal levels, right? It's just they got there in different
scales.
ways.
And have you talked directly to the FDA or DEA? Are they open to communication?
So I haven't talked to them directly, but I can tell you that we'll definitely be in talks with them over the coming months and years, right? It's absolutely stipulated within Measure 109 that to the degree that that the federal government, the FDA, DEA is willing to work with us, and we want to work with them, right? We want to create a program that helps them feel comfortable that like they don't need to intervene, right? This is still Schedule 1. Even if the FDA says this is the best thing, since Cheerios, like we can't take that for granted. And so, at the end of the day, it takes two to tango. And so, we're absolutely going to be working hand in hand with not only the governor's office, the Oregon Health Authority, stakeholders, community members, but the federal government as well. And so it's incredibly important that, again, we take our responsibility of going first incredibly seriously. And that also involves, communicating, liaisoning, and working with the federal government to the degree that they're interested in working with us. So, the jury's not out on that one yet, but, we're prepared and ready. And we want to create a program that, again, really centers client-patient safety training protocols, I'm sure, which is a lot of what the federal government cares about, in addition to ensuring this is an accessible, equitable, affordable program. And again, I'll say it again and again, that is easier said than done, but that's the good work that we have before us over the next 2 years.
Yeah. Yeah. We actually reached out to the FDA and the DEA to do a podcast episode, or at least talk, and specifically around hemp, because that's federally legal. They are non-officially regulating it, but they are kind of. And so I thought someone reaching out to talk about something they're legally, federally covering, they'd have to talk to us, or at least like answer questions, and like nobody would talk to us at either organization. And I almost felt like there should be an obligation on their end that they have to answer questions when they could come storming in. And it's like, well, if you would have told me this, I could have done things differently. But I was curious about that communication barrier or gap, if that was, I'm not sure what their approach necessarily is or strategy, but it seems more hidden and behind closed doors. And that makes it really difficult for people out here right now,
Yeah, I totally agree with your assessment. And I think they may not know, right? Especially right now, right? We're in an administration transition. A lot of people are on the fence. Are they staying? Are they going? If they're going, who's replacing them? If there's new replacements coming in, what's their view in general, right? What's their view about Oregon? What's their view personally? What's their experience, right? And so I think it is a case-by-case basis, and exactly, for that exact reason, that's why we have to, start from square one with everyone that we talk to. We have to start on the same basis. We have to be starting from the same facts. We have to agree that science is fact and not opinion. There's a whole lot of like who's on first type of situational analysis that's political and scientific and fact, and communication, right? That goes into every single one of those communications. And so there's a lot of variables, and there's a lot of fluidity right now, right? Like, it's not, Oregon made history twice this election. Well, shit, we probably made history 3 or 4 times. I'm losing count on how many historical things we've done in the last couple of months. Yeah. But, not only Measure 109, but Measure 110 too, decriminalizing small possession of most all drugs. That's huge, right? And so, I think there's a lot of nuance to what we're doing here in Oregon. And I think now more than ever, we're doing it in not only a way that's politically viable, but in a way that is really smart and responsible, right? I think that we've definitely had a history of shooting for the stars, and we should never not do that. Let's always swing for the fences for sure. But let's have a legitimate political reality backstop right behind it. And I think we're starting to prove that is the model moving forward, right? Again, we should always lead with our hearts, but our brains need to understand the equation of political reality, and the political reality, if we go too hard for something, that there might be a backlash, right? There's a lot of legitimate concern about a psychedelic renaissance backlash happening now, just like happened in the 70s, right? I don't think that's going to happen. At least it's not going to happen because of Measure 109 for sure. Yeah. 2022 is going to be a different monster, right? There's going to be a whole lot of people introducing all kinds of things, some of which will be great, some of which will never see the light of day, some of which are going to have implications on everything that everyone else is doing, right? So it's incredibly fluid, and that's also what makes it really exciting, right? There's so much going on. We've got so much opportunity to help so many people. We just really need to keep our eye on the ball, and right now the ball is here in Oregon.
Yeah. Before we move on to kind of the vision of Measure 109 and the landscape in Oregon and what we hope that looks like, back to kind of the campaign and the marketing piece. I think for listeners that might be in another state, they want to get involved. Is there a formula so you mentioned like putting out the TV commercials and those 4 main points that you have to educate on. You can have that fine tuned. It's great, but if you can't get it in front of the right person at the right time, it's very difficult. Is there kind of a formula that you think about, like, one, funding so you can get TV commercials and exposure versus the opposition that you might have to go up against on the odds of like getting something passed? And you mentioned TV commercials. Are there other channels that you found really helpful and successful at getting those points out that you mentioned?
Yeah, absolutely. I mean, you nailed the whole foundation right on the head at the beginning of that, which is money. I'm sorry, like community organizing
Yeah.
isn't what pushes forward major state organ. It's key. You can't do it without it. But to think that that's the only, like, you just get enough people who care about it, like, sorry, like that's not how it works when it comes to like educating millions of people on a specific subject that they've never heard about. It takes money, and you have to get in front of them. And right, so I think that there is a formula, one that we had to rewrite about 18 times because of the pandemic, on how to run and win a campaign, right? And so, the traditional parts that remained intact were, you need to raise several $1 million to buy TV ads, right? Every 30-second TV ad that you want to air, in the major TV markets around the state of Oregon is going to cost you $250,000 to $500,000, right? We ended up raising over $5 million for this campaign. That's more than we thought we were going to need. And it turned out we needed more money than we needed, right? So fundraising is absolutely key. The good thing is that, as a result of a lot of the progress that's being made at the FDA level and psychedelic research and progress in general, means there are more people that are open from either a philanthropic perspective or, a business perspective that want to see this, come to fruition. And so the number of, philanthropic and general donors overall is starting to increase. Mm-hmm. But again, it's all eyes on Oregon. This is our opportunity to seize or ours to lose. And funders are watching very carefully. And that's one of the reasons why, I'm in my new position now as the executive director of the Healing Advocacy Fund is, again, everyone understands that not only for the sake of Oregon and Oregon's program, but, if we screw this up in Oregon, we're screwing it up for other states and countries to come. And so again, it's just one of the reasons that we take this so seriously. But, we did a lot of polling, a lot of message testing around who the best messengers are and what are the best messengers for them to convey. Right. And so we tested a lot of theories. Right. And, overall, some of the most powerful, messengers and messages came from, terminally ill cancer patients, right? Veterans, right? Folks from the BIPOC community that are being disproportionately affected by the impacts of COVID right now. Mm-hmm. We had a state senator, Elizabeth Steiner Hayward, who also happens to be, not only a medical doctor who, and a mother at OHSU, but she's the co-chair of Ways and Means in the legislature, right? She's an incredibly powerful figure. And she also has not been shy about sharing her own struggles with depression, right? She's been on antidepressant medication for maybe 20 years. And so having those types of spokespeople that either can hit on the emotional heartstrings, right? Like real hard to deny a terminally ill cancer patient anything that they want towards the end of their life, right? And real hard to argue against an 18-year Navy SEAL with 13 combat deployments that came back with every form of PTSD under the sun, who said, one psilocybin therapy session saved my life. I am here today because of psilocybin therapy. Really hard for the average person to argue against that. Do we still have opposition after giving that message? For sure, right? But again, appealing to the heartstrings and the emotional appeal combined with the science and the facts that we can point to from major medical institutions around the world, not only here in the US, but really around the world, that's a 1-2 combination that I think that really laid the path for the trajectory that we're now on, which I actually think stands to be faster than cannabis because of the science that is out there. And so I am really excited to see, how this continues to take shape here in Oregon and how that has impacts in states and countries around the world. Yeah.
Yeah. That's awesome. That's interesting to hear. And yeah, the kind of the social acceptance or how that versus the stigma it's got to overcome. And you mentioned the kind of the financial piece or entrepreneurship piece early on. So let's go into Measure 109 Pass and then the Healing Advocacy Fund. I guess set that up for listeners. What is it? And, kind of our next steps forward, what you're doing.
Yeah, so the Healing Advocacy Fund is a new nonprofit that is set up to essentially do the continuation of education work that Measure 109 and the campaign did, right? So just because we passed the measure does not mean we can afford to stop educating people. And in fact, education is key now more than ever because there's a lot of people paying attention, and we need to make sure that they understand we've given ourselves 2 years and we take our responsibility very seriously, and we've got a lot of work to do. And so there's no reason for, the legislature to come in and change a bunch of things, right? We haven't even started to get to work, right? So educating legislators, educating the OHA, educating people in the governor's office, educating, future advisory board members and the general public that may really have only heard about Measure 109 like November 2nd, right? They got their ballot, they opened their voter's guide like 12 hours before they had to submit their ballot, and holy crap, what is this, right? And so we very much still believe that education is a key component to ensuring that we can create the best, most affordable, equitable, accessible program that we can here in Oregon. So first and foremost, the Healing Advocacy Fund is here to educate and to protect the intent and the spirit in which Measure 109 was passed by Oregon voters. And, there's a lot of different scenarios, right? Whether it's the federal government expressing concerns or the Oregon Health Authority or people from the traditional medical field that don't like this or don't want it to exist, right? I think there's a lot of different moving pieces and stakeholders in that equation. And it's really important that we continue with the education process and help people understand how serious we take this responsibility and what exactly it is that we're going to be doing over the next 2 years to, again, ensure that we create a program that as many people that stand to benefit as possible have access to.
Yeah. How do you see pharma fitting into the picture around psilocybin? Because the conspiracy theory side was always like pharma doesn't like something that you could potentially take once and have a positive outcome and never need again versus something you have to take daily for the rest of your life. Are they interested in psilocybin? Do we know? Is that kind of very murky right now, or how are they viewing it?
Yeah, it's a good question. I can't personally, can't speak for big pharma,
Sure.
right?
And there's a lot of different, that's a very general
that. But,
term. Yeah.
Again, I think that big pharma probably learned a pretty important lesson in opposing cannabis and that they're on the wrong side of history. It's like, sure, maybe you can slow this train down, but there's no stopping it, right? And so I do think that, based on, some of the different businesses and models that I've seen out there is that they took a lesson from that, right? And so they may be developing their own play within, the psilocybin or larger psychedelic industry at the national level in general. I don't really know, but, I do think that if I had a hunch, they're looking at this as more of an opportunity than they are a threat, right? They can't afford to keep their feet in cement. If they do, they won't be around for much longer. The promise that psilocybin therapy alone shows to potentially replace daily medications is huge. And I don't think even they can deny it, right, at the end of the day. And does that mean that they're not going to potentially try and slow it down? Sure, they might, right? Yeah. But in terms of Measure 109 and the opposition that we saw, we didn't see anything from big pharma. The opposition that we saw was unorganized and not well-funded at all. And it was primarily from, physician, from the Oregon Psychiatric Physicians Association that, doesn't really like the idea of a new industry encroaching on their prescription pill model, right? So I think, time will tell over the next 2 years about who else tries to throw wrenches in the engine. But again, I'm not going anywhere. That's exactly why I'm here and look forward to, helping people suss out their concerns. I have concerns too. I am concerned about ensuring that we make this thing equitable, right? And affordable. And I'm also concerned to make sure that we do that while we're still making sure that there is a standard for training and certification to provide, as much, safety and efficacy within the program as possible. Again, easier said than done, but that's the task we have in front of us. Yeah.
Do rehab recovery centers, do they play a role? I've heard that industry is bigger recently than I ever really thought it was. Are that almost another industry kind of like pharma that you have to think about?
Yeah, absolutely. And I think we think about them more as allies than necessarily people that would be opposed to this, right? I think, as you've kind of highlighted, addiction recovery industry is not necessarily a super sexy industry for anyone, right? People cringe at the idea of thinking about people that are struggling with substance abuse issues, but there's so many of them, right? And I think, it's funny. I had a call earlier today with some folks that work in the palliative care and hospice industry, right? There are so many healthcare industries that exist now that want to add psilocybin therapy to the toolbox, and they should, right? And in fact, I think having them involved in those conversations adds even more legitimacy to the fact that this is a tool that so many people stand to benefit from. and adding them to existing infrastructures within the larger medical and healthcare system is huge, right? The key is making sure that adding them to those existing systems does not create additional barriers to entry, right? And so, I very much envision, a lot of treatment recovery, clinics and treatment facilities wanting to add this to their portfolio, as well as hospice and palliative care folks, right? We had a huge focus on palliative care during the campaign because, Oregon is a death with dignity state. For starters, another thing that we champion that we're proud of, right? If you have the right to end your own life, you should probably have the right to end it in a peaceful, blissful way where you don't have nearly as much anxiety and depression about dying, right? That's what psilocybin therapy can provide. And so I do think that there's going to be a lot of really cool fusions with existing industry. I think the key is going to make sure that, folks that are coming from more of a traditional healthcare model are coming with their eyes wide open. That's not to say that they can't and shouldn't have concerns. They will. And many of them, again, we share as well. But it's really important that people understand Oregon voters said yes to this. Not only did they say yes, they said yes to the tune of 56%, right? So this is no longer a conversation of should we, it's a conversation of how are we going to? And I think that, that's what the next 2 years is going to completely hinge on.
Yeah, that made me think of the insurance piece and around like cannabis right now. Insurance is covering what pharma will make and is, I don't know if it's patented necessarily. Some of it is, but that it's, they've got their approval through trials. Cannabis on the other side isn't covered by insurance. We don't see that happening anytime soon. Hopefully one day. With psilocybin, I was, would insurance and covered eventually, but the amount you might have to take or the use of it is fairly low. 1 time, 2, 3 times. The costs alone, just without the insurance coverage, really aren't that much of a barrier, assuming the market stays, there's competitive and it's not owned by a couple people like a pharma company that patented it or something. The costs aren't extremely high when you look at the costs of other types of therapies.
Yeah, therapies, medications, right? Yeah, the cost-benefit analysis potential is huge, right? And that's definitely something that I'm super interested in is, over the next year, I'd love to work with some economists to start doing some projections on what the cost benefit saving analysis is, right? That's going to help us justify, more resources for the program, right? A little bit of investment up front can go a long way on the back end. And so we're just scratching the surface on those type of conversations. Going back to, will insurance cover this, right? The honest answer is I have no idea. I can tell you that throughout the campaign, we have been engaging to the extent that insurance providers are willing to engage with us and helping just kind of bring them up to speed. This is what psilocybin is. This is how people have used it. This is the context in which it is starting to show real promise and for these types of things. And so I think that it's going to take a coalition effort between insurance providers, between the community, between the state, between state agencies, and people who are seeking these services and people who are providing these services to really understand how we have many opportunities that are going to collectively make up what is or is not equitable, affordable access, right? It's not just here's how we're going to do it. One person is tasked with it. That's not realistic. It is a total community, all hands on deck type of situation. And we need to have play from everyone involved, right? And so I think the other really interesting thing that was a big concern for a lot of people during the campaign, which I think has been swayed a little bit now, is that, this somehow conflicts with FDA trials, right? It really doesn't. FDA trials at the federal level, state level, psilocybin therapy, and decriminalization in general, they all can synchronize, right? They all don't necessarily have the same political lane in terms of success, right? Like there's a reason Measure 110 and Measure 109 were separate, right? They're different issues. One is a racial social justice. The other is therapeutic and healthcare focused, right? And so there's a reason we separated those two things.
Thank you for watching the podcast. If you'd like to support the work we do and receive a great product in the process, you can buy from one of our edible companies where we make everything in-house. Periodiccaramels.com is our hemp butter CBD caramel line, ships across the country. Or if you're in Oregon, you can get our higher THC cannabis caramels. You can find those at periodicedibles.com. We've got links here and here, and then down in the description as well. Thank you for watching.